respond to the argument that healthcare is too important to be left to the free market?
Well, I have a saying about that. You can take any issue and say blank is too important to be left to the free market. And whatever blank is, fill in that blank, will be messed up because the government will mess it up. And the answer is the more important something is, the more important it is not to have the government messing it up. You want the market to handle it.
There's also an argument that you can't put a price on health care. And in the case that you don't, what happens then?
Where you destroy the pricing mechanism for anything, health care or airline travel or food or automobiles or whatever, you destroy the thing that you're trying to protect. Because price is the thing that governs how much of something people consume and how much of it will be provided. Supply and demand, as they're called in economic studies. And when the pricing mechanism disappears, then the thing goes haywire. And you either have too much or too little of what you're trying to produce offered. And in the case of a good that is offered for almost nothing, you have a massive demand for it and rising costs, because then whoever's paying the bill has to fork over more money to pay for it. And then you have rationing, care denial, and that's exactly what we have in our healthcare system now, and we'll have more of when they pass this bill down the street here that they're working on today.
I'm glad you brought up the issue of rationing healthcare. To what extent can the government ration healthcare, or has it already?
It's already rationing health care under Medicare system. What they do, they ration it by just refusing to pay. And if you are under that system, they decide what is covered and what isn't. And that's going to be much more pervasive because they will not pay the provider. That's the way they do it. They won't pay the hospital. They won't pay the physician. In some cases, they will actually, if they go the full route, like in England or other countries with socialized medicine, they will just deny the procedure. You cannot have that procedure, period. That's the way they do it, and they do it because they control the funding. The funding is the way they do it. The media are, I said at a little talk I gave not too long ago, that there is almost nobody in the media that understands this stuff to begin with. Most people in the media have had no training in economics. They don't want to have any training in economics. They don't want to think about economics, and they are incapable of thinking about economics, and they don't. So that when they're confronted with health care or the collapse of the housing industry or the implosion of the automobile industry or the collapse of our financial institutions, they're clueless. They have no idea why things happen and what could be done to improve it. And since the public relies on them for its information, the public has no clue. And of course the Congress has about the same level of innocence on these issues. So it's, you know, it's a bunch of people who are clueless, making a problem worse instead of making it better.